Thank you to today's presenters. We greatly appreciate the information you brought to our webinar and your desire to help and support women in the EDS population. Thank you to Nellie Fagani for sharing her knowledge on pelvic floor health and that proper training on this subject is the standard treatment for women with Ehlers-Danlos Syndromes and hypermobile spectrum disorders, and highlighting that multidisciplinary care is vital with these conditions. By sharing the 2015 survey revealing that only 32% of physiotherapists were trained in treating and managing EDS and HSD, and presenting your interest and knowledge today, we hope to improve this ratio so advancements in women's care, treatment, and health management happen. It is reassuring to know that you understand the unique needs of women in this population and how these diagnoses affect the quality of life. Resident physician Dr. Ahmad Hassan provided valuable research on EDS, women's health, and what is known concerning patient obstetrical and gynecological needs. As he said, the prevalence of EDS is higher than the data shows, and it is not rare. However, the challenge lies in adequately diagnosing the patient. Related to obstetrics, we know that women with vascular EDS have many risks with labor and delivery associated with collagen abnormalities. Thank you for understanding that access to high-risk obstetricians depends on where you live. Urban versus rural settings and resources on pregnancy with EDS are critical. As Dr. Hassan mentioned, these resources are minimal and the limited current studies state insufficient data. Asking the much-needed question, is it reasonable to tell people with EDS not to get pregnant based on the little knowledge available? Further, the gynecological issues are highly diverse and previous studies completed are primarily observational. Again, with difficulty for many women in getting a diagnosis of EDS, the data is skewed and not easily understood, and pregnancy complications are not studied adequately, so the data is not gathered and documented correctly, thus the evidence is unclear. This collaborative research work and the multidisciplinary perspective Dr. Hassan's study brings to the healthcare sector will improve care in obstetric and gynecological outcomes for women with EDS. More robust studies such as this will enhance knowledge of the health factors of this population and the high prevalence of primary infertility, pregnancy complications, and, no surprise, postpartum concerns, revealing how necessary a safe, inclusive, and effective care experience is. As Dr. Hassan said, providers need to understand the bare bones of obstetrics and gynecology in patients with this diagnosis to realize the proper interventions for care, how to minimize pain for women, and what effective treatment will look like. We, like you, Dr. Hassan, are hopeful that knowledge of EDS in mainstream care is gaining traction, much like how endometriosis was largely unknown 10 to 15 years ago. The key is that these women have unique and challenging health concerns with many overlaps. Listen to the patient and connect the dots. We at the ILC believe there are many zebras and much fewer horses. Dr. Pizzaro shared her understanding of the challenges and fears some might experience in their pregnancy journey, including the years of frustration when attempting to share health concerns, and as Dr. Hassan pointed out, challenges with getting a diagnosis. As Dr. Pizzaro shared, pregnant women with EDS will experience increased symptoms related to connective tissues, impacting physical and mental aspects and causing increased pain. Dr. Pizzaro articulated this as a double whammy for women with EDS and connective tissue disorders with joint laxity, and shared valuable points in the pregnancy journey from management and symptoms in the antenatal period to the problematic healing of tissues in the postnatal period, revealing the importance of a multidisciplinary care team for the best rest, recovery, and maintenance of your body and your babies, as it has a 50% chance of inheriting the condition. Dr. Pizzaro's Care Considerations paper and its recently published updates are beneficial from the midwifery perspective to increase personal and, more importantly, provider knowledge to understand women with connective tissue disorders better. Focusing on patient narratives to enhance clinical knowledge and education is a vital inclusivity factor that we at the ILC agree with and recognize is necessary for an equitable, successful healthcare system. listening to patients' unique stories will improve sector knowledge and patient care and contribute to informed decision-making. We thank Dr. Pizzaro for leading the International Consortium on EDS and HSD, the HEDStogether.com team and your sector collaborators for their work and creation of a downloadable decision-making tool, educational resources, and an iLearn module for women with this diagnosis to improve communication around clinical care pathways. Provider awareness of the range of comorbidities and how they affect women's general health and pregnancy will ensure a tailored approach to patients' unique needs. A respectful partnership of care where collaborative providers listen to patient needs and provide supportive counseling will ensure best practices moving forward. Thank you for joining us today on the first webinar in our 2023 conference series. We are excited to share that our next afternoon webinar will take place on Tuesday, June the 27th from 1 to 4 p.m. and will offer presentations on the management and diagnosis of Ehlers-Danlos Syndromes. Presenters at this webinar include the ILC Foundation's Board Director, Tammy Statt, who will share how you can build your care toolkit and what is known and unknown about EDS and chronic pain. Jordan Jones and William Black, researchers from Children's Mercy in Kansas City, will discuss the results of their provider knowledge and experience in care, management, and education of Pediatric Ehlers-Danlos Syndrome 2022 survey. We will provide specific details on additional speakers closer to the date. On November the 4th, we will conclude our 2023 series with our full-day conference focusing on the lurking symptomology. Dr. Linda Bluestein will join us to present an integrative medicine approach to care in EDS and HSD, and Dr. Claire Francomano will provide a deeper dive into the management and diagnosis of EDS. Again, we will provide specific details on additional speakers closer to the event date. We are grateful for this afternoon to come together to listen, learn, and share. As Dr. Duff has mentioned, we will post the presentations for you to access for future reference. Have a wonderful evening and see you on June 27th at our second event in the Canadian Ehlers-Danlos Syndromes 2023 Conference Series.